The most obvious and noticeable signs of aging are deep lines, and those we can treat with Botox. Then there's saggy skin, then that we can treat with lasers. And the third one is gaunt face, caved in gaunt face, and that we treat with fillers. So let's talk about Botox in detail. The muscles are 4 muscles which we can help with the prevention of deep lines. Muscle number 1, there's 3 muscles here. So this is what creates the frown lines. Contraction of this muscle and this muscle. The procerus, the corrugators, 2 corrugators, they are downward pull muscles. They pull the inner aspect of the brow downwards. And also they create these 2 lines, we call them 11. This is the procerus, and these are the 2 corrugator muscles. The 2 muscles contract, they contract very severely. So what Botox will do, will soften these frown lines and will prevent the pulling down of the inner brow. It's our control that how much do we want to relax the muscle? Do we want to relax it 10%? So if there's an actor who is playing to be a judge or an attorney and needs to have all the intense expression, in those cases we do not want to soften these lines too much because we want them to be intense. So it's up to the injector and the patient's needs, which tells us a good injector to relax the muscle by 10% or 30% or 50%. At no time do we want to completely eliminate the contraction of this muscle, because then it looks like a mask face, expressionless face, and there is no reality to that face. So muscle number 1, procerus and corrugator. So that's muscle number 1. Muscle number 2 is this frontalis muscle. And this frontalis muscle, the function of the muscle is to lift the brow. It lifts the brow. That's the normal function. And that muscle has to be injected very, very softly, because you do not want to interfere with the upward mobility of the brow. You need this movement. You need this upward movement to keep the brow in a natural position and have absolutely no detrimental effect, so the brow can come down. So this is a very, very sophisticated Botox, as to create no harm. So one has to be really careful not to inject these muscles very severely, because if you do that, the upward motion of the frontalis is no longer there. So the brows will sag and it'll distort the shape of the brow. So that's the frontalis Botox, and that's this muscle. It's a big band of muscle, so one has to be careful. Now we come to muscle number 3, and that is this orbicularis muscle, orbicularis oculi, and this is the muscle which is pulling the brow downwards. So it's a balancing act to balance the downward pull from the orbicularis and the upward pull from the frontalis. Here, by being a little bit more aggressive, you are able to relax the downward pull. So net, our goal is to get 1 to 2 to 3 millimeter of elevation at the lateral half, outer half of the brow. This muscle is a pull down muscle. So if you are clever, you can lift the outer aspect of the brow a little bit further, 1, 2, 3 millimeters gain. And again, you don't want to lift it so it has the Spock effect. It has to be normal contour of the brow. And so it takes quite a bit of calculation and thinking between how to balance these two muscles, the frontalis and the orbicularis. And then you have the corrugator and the two procerus. So this is the balancing act between these three muscles. Number 1, procerus and corrugators. Number 2, frontalis. And number 3, the orbicularis muscle. This orbicularis muscle, when it's very severely contracting, it does two things. A, it pulls the tail of the brow down. And secondly, it creates these crow's feet. It creates these lines which we call crow's feet. Now, some of these lines can go under the eye, and it's important not to Botox this area, or you have to be extremely careful and micro dosage to reduce some of the lines under the eye. But you cannot do strong Botox because then you can pull the lower lid downwards. So one has to be extremely knowledgeable about the muscles around the eye. But the crow's feet, dual advantage. 1, to soften the lines, and 2, to raise the outer half of the brow a little bit further. So balancing the frontalis and procerus with the frontalis, with the orbicularis, this is the 3 muscle Botox. Typically, it needs repeating every 3 to 4 months, because you don't want to do a Botox where you're completely relaxing the muscle and interfering with the functionality of the muscle, the normal expressions of the muscle. So if you're doing a natural Botox so that it does not look like you're interfering with the movements, then it has to be done a little bit more often. And the muscle number 4 is this large muscle, starts with depressor. This is a depressor. Name of the muscle is depresses the angle of the mouth. Depressor anguli oris. Oris is mouth, depresses the angle of the mouth. The platysma and the depressor muscle. The depressor muscle is going to deepen the laugh line, deepen the marionette line, and create the jowling effect here. So none of us like this deep lines and this marionette line, and a lot of injectors, if they're not sophisticated, they keep filling these lines without taking care of relaxing the depressor muscle. So the depressor muscle has to be relaxed so it's not so intense. Look at the neck Botox. This platysma muscle is big muscle and comes down and attaches itself to the collarbone and beyond. So if you leave it intact, it's going to keep pulling your face downwards. It's going to keep pulling the lower part of the face and the neck downwards, almost like a rope pulling it down towards the collarbone. So if you look at this other view of the platysma, look at how deep this big muscle is. If you leave it intact, it's just going to keep pulling this down. Depressor anguli. So 3 things. If you leave this DAO muscle completely intact and not do any Botox, then you're going to have deeper laugh lines, deeper marionette lines, and jowling. So in my opinion, to prevent the sagging and the aging face, this becomes of paramount importance. Platysma muscle is big muscle and comes down and attaches itself to the collarbone and beyond. So if you leave it intact, it's going to keep pulling your face downwards. So this deep pull down effect of this long muscle, if it's not relaxed, if you don't Botox it, then this downward pull is very detrimental and is obvious telltale sign, one of the first telltale signs of aging. Now, the masseter, the temporomandibular joint, is somewhere around here. A lot of us, we grind our teeth at night, and by doing so, we activate this platysma whole night and has more downward pull movement. So the people who grind their teeth, about 5 to 7 to 10 units of Botox, depending on how intense their masseter is, deep into the muscle and you're able to relax this muscle, which helps preventing some of the grinding and thereby also helps with preventing the downward pull. So people who have very strong platysma, including myself, because I also grind, then I have to do both the masseter Botox as well as the platysma Botox so that we can prevent the downward pull. Now, while we are on the subject, the platysma Botox cannot be done on the midline because right here is your trachea. And so that being the case, if you're not careful, you could interfere with the swallowing, and that's why one has to be very clever and maybe half a unit to 1 unit in the inner aspect of the platysma. But the lateral bands, the outer bands, a lot of people have 1, 2, 3 bands which are pulling you down, and those bands can be injected with Botox. So to me, this becomes the most important Botox out of all the 4 muscle Botox. And strangely enough, 90% of the injectors are not knowledgeable or scared of interfering with the swallowing effect, and that's why they don't do it. So common Botox is these 3 muscle Botox, and the 4th muscle is completely ignored. So as I said earlier, this is very, very critical Botox, important Botox to prevent the signs of aging.